Hey everyone, and welcome. Today, we're going to crack open a simple blood test that holds a major key to one of our biggest complaints, just feeling tired all the time. Yep, we're talking about the ferritin test, and trust me, it has some pretty big things to tell you about your energy, your health, and a whole lot more. So let me just ask you something straight up. Are you tired of being tired? I mean, really, if that feeling of just being constantly drained sounds a little too familiar, then you are in exactly the right place. Because today, we're going to play detective and start looking for the real cause. Okay, let's dive right in. We're calling this the fatigue mystery. Why? Because that feeling of being totally run down, maybe a little dizzy or just weak, sometimes it's not just from a long week at work. It's actually a collection of clues your body is sending you. I'm talking about things like that fatigue that just won't quit. Maybe you notice you have pale skin or even constantly cold hands and feet. Now, on their own, you might just brush them off, right? But when you put them together, they often point to some kind of imbalance in your body that really needs a closer look. They're like the first breadcrumbs on the trail. So, what is the number one most crucial clue in our little mystery? Well, it all comes down to a little something called ferritin. And honestly, the best way to think about it is like your body's own personal iron bank. Let's dig into why this bank is so incredibly important. So what is it exactly? Ferritin is a protein that literally stores iron for you. It's like a tiny vault that holds on to this essential mineral and then releases it whenever your body needs it, for things like making new red blood cells or just keeping your energy up. So a ferritin test isn't just measuring the iron you have floating around, it's measuring your reserves. It's a peek inside your body's iron savings account. But here's where it gets really interesting. Ferritin is a total multitasker. Its main job might be iron manager, but it actually plays a few other really important roles that give us a much, much bigger picture of our health. And check out these key roles. I mean, yeah, it's the number one indicator of your iron reserves, for sure. But high levels can also be a red flag for inflammation somewhere in your body, maybe from an infection you don't even know about. It can even give us clues about how well your liver is functioning, so this one little number gives your doctor a surprisingly wide snapshot of your overall health. It's pretty amazing. Okay, so let's shift gears and see how we actually investigate these levels. The great news is the process is super straightforward. But the real question is, what are we looking for in those results? It really is as simple as 1, 2, 3. Your doctor will probably ask you to fast for about 12 hours. Water's fine, though. The test itself, just a quick little blood draw. And that's it. In a few days, you'll have your numbers. It's such a low-hassle process for some seriously valuable information. All right, so when you get those results back, you're going to see a number. For men, the typical normal range is usually somewhere between 24 and 336 micrograms per liter. And for women, it's a little different, generally between 11 and 37. A big reason for that is iron loss during menstrual cycles. Now, I have to stress, these are just general guidelines, okay? Your personal normal can totally vary, which is exactly why talking it over with a doctor is so important. So, this is the crucial part. What happens when your levels are outside those normal ranges? What is your iron bank balance really telling you about what's going on inside your body? Well, think about it like this. If your bank account is empty, that's low ferritin. You might see those classic symptoms we talked about: fatigue, shortness of breath, pale skin. But if your bank is overflowing, that's high ferritin. The signs can be totally different. We're talking things like joint pain, stomach discomfort, or even a weird change in your skin tone. And those symptoms? They connect directly to some very real health conditions. Low levels are the classic sign of iron deficiency anemia. And high levels, that can point to something called hemochromatosis, where your body just absorbs way too much iron. Or, like we mentioned, it could be a sign of liver issues or chronic inflammation. This is exactly why getting checked can be so powerful. And listen, this isn't just about numbers on a page. It has a real-world impact. Take this patient, for example, who's just exhausted all the time. A simple ferritin test showed they had iron deficiency anemia. Once they got the right treatment, their energy levels shot up in just a few weeks. It was an absolute game changer for them. And here's another story, but from the other end of this spectrum. This person had a family history of an iron overload condition. Because they were proactive and got regular tests, they caught their rising ferritin levels early. That allowed them to manage it before any serious damage was done. It's a perfect example of how this test can be an amazing preventative tool. Okay, so we've followed the clues, we've kind of solved the mystery. Now what? Let's talk about the most important part of all, turning this knowledge into your own personal health action plan. Now, depending on your results and, of course, your doctor's advice, managing your levels can be really practical. It might be as simple as eating more iron-rich foods like leafy greens or beans. But here's a really crucial point. You have to supplement smartly. Never, ever just start popping iron pills unless your doctor specifically tells you to, because too much can actually be dangerous. And remember, if inflammation is the real culprit, well, that becomes the next mystery to solve with your doctor. And that right there brings us to the single most important step you can take. A ferritin test is not a do-it-yourself diagnosis tool. Think of it as a powerful clue, a piece of data that you can use to start a really smart, informed conversation with your doctor about your health and how you're feeling. So let's just bring this all home. Why does all this matter for you? Well, because early detection can literally stop long-term problems before they even start. It helps you and your doctor manage any chronic conditions you might have way more effectively. But honestly, the biggest thing is that it empowers you to take back control of your daily energy and just fundamentally improve your quality of life. So we'll leave you with this one last thought. We've talked about ferritin as your body's iron bank. After everything we've covered today, maybe it's worth asking yourself, is it time to check your balance?